if you did a bone marrow transplant today, what would be the problems you'd be watching for immediately, a month, and long term? What would they be?
Well, the first set of problems are related to the fact that the donor, the recipient, has to be prepared for the transplant. And this preparation consists of suppressing the immune system so that the graft can take. In the process of doing that, the patient receives chemotherapy or chemotherapy and radiation. This makes the patient extremely vulnerable to infection. So the first risk to the patient during this vulnerable state is infection. We protect them in isolation rooms. We are very careful about cleanliness. We treat infections expectantly. So if you have a fever, you get broad spectrum antibiotics that cover a variety of potential infections. And we can usually get the patient through that. The next problem...
Well, that period of infection you're worried about, how long does that period extend to?
Well, the type of infections you may be vulnerable to change during the time of transplant. In the first month, it's really bacterial infections are the thing that we worry about the most, although these patients remain very vulnerable to viral infections. And viral infections are more difficult to treat. But bacterial infections, the usual infections that one might see, staph infections, so-called gram-negative infections with bacteria that reside in the bowel are also a risk. So the first month you're quite vulnerable to bacterial infections as well as viral infections. You also have to contend with the consequences of the therapy, the chemotherapy and radiation that may be toxic to certain organs. So we're very careful to support those organs carefully during this time period. Then after engraftment, when the bone marrow starts to take, the enemy now becomes the immune system of the donor, which in the recipient recognizes the recipient as not being self and may mount a reaction, just as if you were considering the recipient to in fact be a germ. And the immune system of the donor may attack that recipient, and we have to immune suppress the new immune system until that immune system takes.
How long does that risk, as a major problem, last?
We have to suppress patients for 6 to 9 months in some settings, longer in others. So it really depends upon the type of transplant and the relationship of the donor to the recipient.
But the rest of their life you have that potential?
The majority, the vast majority of patients will develop a tolerance so that the graft suddenly, over time, recognizes the recipient as being compatible, and you can cease to take immune-suppressing drugs, usually within a year or sooner after transplant, if it's done from a sibling that's matched. If it's done from an unrelated donor, it may be longer. But the vast majority of donors, as opposed to solid organ transplant, can stop taking immunosuppressing drugs and be perfectly normal. What we say is that your child is normal enough to play in dirt, meaning your immune system works, it fights infection from outside, and your immune system no longer is attacking your own body.